Hello and welcome. This is Dr. Peter Nixick, resident at the University of Wisconsin, Division of Plastic and Reconstructive Surgery. On behalf of the Poor Lab, we would like to thank you for watching our supplemental video on alternative back wall first end-to-end microanastomosis performed by Dr. Wei-Fang Zhang. This video will cover Lesson 6A of the Microsurgical Training Manual, Alternative Back Wall First Microanastomosis. Similar to the method of back wall first end-to-end anastomosis described in Lesson 5, this alternative method allows the surgeon to perform an end-to-end anastomosis when there is inadequate length in the pedicle and recipient vessels in order to flip the anastomosis 180 degrees to expose the back wall. After the adventitia are trimmed, the first stitch is placed in the middle of the back wall in the surgeon's forehand. The second throw of the first stitch is thrown in the surgeon's forehand in the middle of the back wall of the opposite vessel. When tying, differential tension on the edges of the sutures can help to perfectly align the edges of the vessels. The second stitch is thrown in the forehand on the side furthest from the surgeon. Unlike the back wall first method described in Lesson 5, you are able to throw the majority of your back wall sutures in the forehand using the alternative method. As always, manipulate the adventitia of the vessel with your forceps in order to provide adequate counter tension to take your bites. The third stitch is completed similar to how the second stitch was thrown, except on the side nearest the surgeon. Note that the stitches thrown on the side closer to the surgeon are backhand first, forehand second, left to right, like the traditional back wall first anastomosis described in Lesson 5. So you continue to throw sutures on alternating sides of the initial suture in the middle of the back wall until the back wall anastomosis is complete. Now that the back wall is complete, the front wall is performed identically to how it would be done in a two-stay method. In this video, the surgeon decides to run the front wall of the anastomosis. When using the running closure technique, it is helpful to leave the needle in place within the vessel wall of your last throw, as it will act as an anchor and prevent suture pull-through while you're tying. At the completion of the anastomosis, the double opposing Acklin clamps are removed, and in the blue blood chicken thigh model, methylene blue dyed saline is ran through the anastomosis to check for patency and leaks. This concludes Lesson 6A of the Microsurgery Training Manual, Alternative Back Wall First End-to-End Anastomosis. Thank you.